What's up, everybody? Medical Mondays, Dr. Alex Spinoso. So the question of the day is, can somebody recover from rotator cuff injuries, whether they're partial or full thickness tears in the shoulder? So yes, but there are a couple caveats to this. The rotator cuff are the four muscles that come from the scapula and insert into the humerus, which is functional to the glenohumeral joint. That means movement of the shoulder in general. Treatment of rotator cuffs depends on multiple factors, including age, sex, partial full thickness, the rehab, whether people are going to do the rehab, comorbidities such as diabetes or obesity, hypertension, blood pressure, and activity level, whether the person was an actual athlete before or a couch potato before. To date, there are only a few studies that have tested surgical intervention versus non-surgical intervention, and there really isn't definitive yes or no answer whether you should get surgery or shouldn't get surgery. However, there are some studies that show that if you have a full thickness tear, getting surgery within the first 6 to 8 weeks after the full thickness tear occurs, you have much better chances of recovery than if you didn't get any surgery whatsoever and just went the conservative approach. So when you have a partial thickness tear, most of the time any surgeon and any physical therapist is going to take the conservative approach. So what do the conservative approach consists of? This consists of physical therapy, an assessment of the shoulder at least every 6 to 12 months, glucocorticoid injections, things such as ultrasound, lidocaine patches, massaging, acupuncture. Doesn't really have as much data, so there isn't really anything that shows that they improve a patient. However, there are a lot of patients that I see that say these things help. So if it helps, why not do it? So the physical therapy is going to include multiple exercises. I'm going to show you 4 stretches and 6 exercises that you can do every day and that I did every day, both before and after my surgery. The first stretch is called the pendulum stretch. You want to relax your shoulders and keep your arm close to your body and swing back and forth from side to side. This is posterior capsule stretching. Reach your affected arm across your body at your chest height and use your other hand to pull your arm closer to your body. Do not pull ridiculously hard. You can damage your shoulder with this one. Another exercise is called the wand exercise. I hold the pole at the bottom and at the middle with my left arm, and I push the left shoulder outwards, rotating the left shoulder as much as I can. The pulley exercise. You want to allow the pulley to pull your arm up so your shoulder is rotating and your arm is almost behind your head. This is an inward rotation exercise, holding your elbow at 90 degrees close to your side. You want to rotate your forearm towards the middle of the body and hold for 5 seconds if you can. The next one is the outward rotation exercise, holding your elbows at 90 degrees, rotate the affected forearm outward. This exercise is called the scapular squeeze, and it may be difficult to see it, but what I'm trying to do here is squeeze my 2 shoulder blades together as much as I can. Relax, come back down, and squeeze again. This is another scapular strengthening exercise. Lay flat on your stomach on some sort of ball or even on the floor, and just try and lift your arms up and back as high as you can. Another exercise you could do is called the quadruped. Here you're down on all fours. Touch one hand to your opposite elbow back and forth. Then once you gain strength, you can advance to more difficult ones. So those are the exercises. I would recommend you doing at least those exercises 2 to 3 times a week and always before your shoulder days. When should you actually have surgery? Usually surgical repair is needed to control severe pain, repair severe full thickness tears, as well as chronic partial tears that just are not getting better. And if you fail physical therapy and the other conservative measures that we talked about. Usually you want to attempt physical therapy for 3 to 6 months. Sometimes longer in older patients above 50, 55 years old. You want to give it a little bit longer. If you still are having weakness, instability, issues with movement daily, pain daily, you want to talk to your doctor about possibly being seen by a surgeon, getting further imaging done. So how fast can you get back to exercising after you have rotator cuff injuries? So if you have rotator cuff tendinitis, which is just inflammation of the tendons, usually about 6 to 12 weeks later after physical therapy is done, you start feeling better, you could get back in. With partial thickness tears, it's going to be a little bit longer, and it's going to depend on the age, activity level, things like that. But partial thickness, the average is about 3 to 6 months after you start a rigorous physical therapy program. After surgery, usually it's about 6 months until you can start lifting again. Now you could do some of these exercises that I showed you afterwards, whether it be a month, 2 months after you have the original surgery. You can start doing the exercises, the stretches, things like that. But actual lifting, you're looking at about 6 months. And most surgeons will say the 9-month mark is where you really start to feel good and can really hit the weights as hard, if not harder, than you did before you had the surgery.